am super excited to hold this conversation today, and I feel very lucky that I'm the one that is going to be able to pick the brains of this exquisite panel that we're having, because they have a lot of experience and also a lot of knowledge. And this is regards to fertility and also newborn healthcare. And I would like to think that I'm not picked for this panel as a moderator because I'm pregnant, but because of my own experience as well. I'll give you a little sneak peek about who I am, but I'll go very fast to our panelists because that's the most interesting thing of the day, right? So my name is Diana, and I'm a medical doctor and also a PhD in pediatrics in Netherlands, but I'm also a co-founder of a health tech company, which is actually changing the sound and digitalizing sound in healthcare. So enough about me. So I would like to ask our first panelist, Deborah, to introduce herself.
Hi everybody, I'm Dr. Deborah Maufi. I'm a Tanzanian based in the Netherlands. And a healthcare project manager, focusing mainly on maternal and newborn health. I bridge innovations in Europe to Africa, sub-Saharan Africa to be more specific. And also I'm a health literacy consultant. That means I provide health information and education to healthcare professionals that focus on women's and newborn health.
Thank you. Thank you so much for your introduction. And then I would like to ask Ana to introduce herself as well.
Hello, my name is Ana García. I'm engineer by training, and I am the head of operations of Overture 𝐂𝐿𝐴. Overture 𝐂𝐿𝐴 is a startup developing technology to robotize and automate the embryology labs in the fertility clinics, so to improve access, to lower the costs, and to improve success rates. So I'm very glad to be here, and I'm bringing my engineering mind to the discussion, and as well, to get to know such amazing woman in the femtech industry.
Thank you so much. I'm really excited, and I hope you guys are as excited as I am. And I would like to ask Mhairi to also introduce herself.
So I'm Mhairi. I am the Sales and Marketing Director of Pera. I joined early on this year. And at Pera, we are trying to revolutionize reproductive health. And our focus is mainly on male infertility because, as you know, throughout history, women have always been blamed as the cause of infertility. And in recent years, studies are showing that at least 50% of the time, the male is either the main factor or a contributing cause to infertility. So we think it's an important field to go into.
Thank you so much. And I hope I have some questions prepared. I hope these are the questions that you guys also would like to ask our panelists. But if not, they're all very approachable in the end to reach out to them or also to connect with on LinkedIn. So you can ask your questions to all of us. So my first question would be actually to Ana. And what do you think that what are the hurdles with a normal fertility trajectory? And also, how can technology solve these issues in this matter?
Okay, so I presume many of you here will know somebody who went through IVF. So basically, so the infertility problem is a global world health issue. We are talking about 148 million of people that are infertile, and they are struggling, 48 couples that are struggling to conceive. And basically, if I had to choose like 3 hurdles, I think the first one is really that you have to this psychological barrier that in the end you have to assume that, okay, you will meet like at least once in a year, you meet your OB-GYN, but then you need to make the switch and say, okay, I have to go to a fertility clinic. So then you have to look for a fertility clinic, you have to screen for doctors, you need to research yourself, and there is lack of transparency actually, what is the cost, where should I go, right? Like all this going at the same time that you are feeling the pain, that it's really hard to conceive. So I would say the first one is the access. The second one is the cost. We use the word that it's not very nice, but it's the baby economics. So to give you some numbers, like the cost of IVF in countries like the US is the 40% of the disposable income of people. In Spain, like we're talking about a cost of 6,000, 7,000 per cycle, and at least you need 3 to 4 cycles. So it is definitely not an investment that you can afford. So starting from access and lack of education, I would say cost, and the third one is really the performance or the outcomes of any treatment. Because in average, so the success rate could be around 25%. So in the end, you don't know how many cycles you need to do. So the patient is really facing all of this, and how technology can solve it is definitely, I think that there will be a lot of innovation in the ways fertilities will offer more patient-centric solutions. And in the case where particular Overture is working, it's really in improving with technology everything that happens in the embryology lab. So standardizing, making it more affordable, and I think so the long-term effect anyway is that there will be more and more people going to IVF labs. So I think I belong already to this generation of people that are having kids like 10 years later that our parents did. And basically the biology also from the men, but from the woman mainly, so has a huge impact. So I think with automation, with more patient-centric solutions, and with the standardization of procedures in the clinics, I think we can really improve the journey overall.
I don't know what about you, but I'm really impressed by all these numbers that you're mentioning. And I love the fact how you actually are empowering the woman in this case, or the patient, let's say, because that's really what is important, I think, in this field, and is really still something that we can really win a lot on. So thank you for your answer. I would like to continue to you, Deborah, from your perspective and also your experience in maternal and newborn healthcare. Which kind of hurdles have you been experiencing? And also, what are the tech implementation differences between the sub-Saharan Africa and US or Europe?
Yeah. I think the quickest hurdle, I would say, for me has been digital and health literacy among the population, especially in sub-Saharan Africa. There's a big difference in how healthcare information is accessible in the Western world compared to sub-Saharan Africa. The power of health information in our case is mainly from the doctor. And you see that the doctor-patient ratio is very low, so the time the doctor spends with the patient is not enough to provide them with enough information. So whenever we try to bring in a new technology, there is a barrier because we still don't understand the basic concept of our healthcare needs. So by the time we get to the hospital, it's already too late. So, and that is why I try to focus mainly on the basis of health information first, empower the patient first, not just the patient, but also just people in general before they become actual patients. I'm talking about prevention information here. Another hurdle, I would say, is a lack of regulatory and policy systems. Only like a couple of years ago, we'll see a country like South Africa, that's one of the advanced countries in sub-Saharan Africa, introduce their health technology policy. A lot of other countries don't have that. That becomes a big barrier when you want to introduce new technology or test new technology because then when it comes to regulations, you're stuck. It takes very long, and you're kind of inventing and innovating with the Ministry of Health as you go because they also don't have the system in place. And you can't blame them for that because they are focused on still the basics of healthcare, access. You know, there are still a lot of people who don't have access. So these are some of the hurdles that people are ready for technology, but it's just, the basic bit needs to be there first. And that's basically prioritization of needs. There are different healthcare needs in the Western world compared to sub-Saharan Africa at the moment. We have different priorities, different things we want to target first before we get to, Web 3.0 or blockchain, etc., which could also be very beneficial. But let's fight the fast battles first before we get there. And these are some of the hurdles. Let me not take much time.
No, that's perfect. And I think, as you were saying, there's so much to win. There's so much to win in that part. And also what I heard you say, and also what made me think, is that also a very powerful tool is not just the patient empowerment, but also doctor empowerment, and that way what we can do. So thank you so much for your answer. Mhairi, I would like to ask you as well, because we have talked about newborn healthcare and mainly fertility related to women right now. About the male fertility, how has technology been evolving in this sector, and where are you making the difference?
So basically, first of all, I want to echo Anna's sentiments. Like, the technology that we're currently using has been in place for many, many years, and it's around a 70% rate of failure if you go for IVF. So unfortunately, more and more people nowadays are turning to IVF. We're having babies later, you know, we have struggles with cost as well. And through this, the technologies are not keeping up with the influx of people who need to use the services. And also, one thing is reproductive health is kind of a conservative branch of medicine and research. You know, people have fears about new technologies in this area, cloning, you know, designer babies, the idea that every baby will be born healthy and perfect. So people are also fearful of any type of movement within this type of technology. So we have to kind of tread slowly. Even if you consider up till a couple of months ago, you couldn't actually advertise the word sperm on a Google ad. It was considered as pornographic. So times are slowly changing, but it's something you really have to fight against.
Yes, well, thank you for your answer. And I think this conservatism, I think what we have seen is that also the female healthcare has been a little bit behind, but also this fertility care has been behind. And especially if you compare it with other healthcare sectors, right? And I don't know if one of you would like to shed your ideas of why we are so behind in this.
Can I? Okay. All right. I think this is it's a very old problem that we are suffering with today, systemic discrimination. A good example would be like the FDA only approved women taking part in clinical trials in 1993. For a period of 16 years, women who had childbearing abilities were not allowed to take part in clinical trials. Now that's almost 2 decades of missing data. And they were working under the assumption that the male and female body are the same. So if a drug works on this one, it also will work on the female counterpart. And that's not true, because we do know that we also have a lot of female-specific conditions. And so that in itself is already a problem that it will take us years to solve, you know? But today we see that there's a rise of so many female founders, girls going into STEM, you know? So we are trying to do something about it. Women, we are taking our power back. We really want to do something about our healthcare. And with that being said, yeah, we see a big rise of the femtech phenomenon right now, which I like to call the femtech democracy. That's basically innovation of women, by women, for women, you know? And I think that is our savior, and we should keep doing that. So it's, yeah.
I just love your answer. And I think my little girl in my belly is also kicking me aside, because she's like, go girl. Really, well, but I really think that you just touched some very, very important subjects there, some extremely important subjects. And I would like to ask Anna maybe, because I think you talked a little bit also about diversity in research, and what has happened in the past. But I also think that diversity, it leverages bigger success to companies, and you all are actually paving the road, right? Because there's in the health tech sector, there's not a lot of female leaders yet, unfortunately. So Anna, what would you like to give for advice for women that are following you?
Okay, so that is a good question. So the first thing that comes to my mind is who was my role model, right? Also in the whole process, and I think it was my mother. And I think the main advice is really talk to women, get inspired by other women, in the same way I was inspired, you know, like when I studied the MBA and I was meeting for the first time, I don't know, like the CEO of Dell in Ukraine, that right now, by the way, has to manage with a lot of staff, very successful professionals, be mother, not having to give up on any dreams you can have, you know, like it's like when you grow up, you feel like you have to decide whether you go for work or you go for family. And for me, I think the best advice it will be like to try to get inspired by other women. I mean, I think basically that's what we are trying to do in the same way, to put women where we are and openly speak about the differences and how important it is that there is VC access, for instance, like VC, that they really empower women in our sector. I really like your answer also before, the fact that to understand how we could be biologically different and psychologically different, and yeah, so that would be in summary what I would recommend. I don't know if I pass it to.
Thank you so much. Yeah, I loved your answer as well. I just inspiring to hear you speak about this. It's really nice to hear how you have experienced it, and and paving the road for the next generation as well. On that note, I would like to ask, I was wondering what you would see for the next 5 to 10 years. What would you love to see changing, or also what do you predict that it's going to change?
For me, I would like to drive more awareness of reproductive health in the younger generation, because like we mentioned, you know, as women, especially my generation, we are choosing to travel. We're choosing our careers over family a lot of the time, and we're deciding to start our family later. And then once we actually get to the point where we say, okay, now I want to have my family, we realize that it's extremely difficult. We can't just go and make a baby like we could have done 10 years ago. So I would like to create awareness. You know, I didn't know anything until this year about this sector. So I just came in this year, and I knew nothing about freezing my eggs when I was younger. When I met my partner, I wasn't even interested in how good quality his sperm was. I didn't even, you know, I think it's something no one considers for now. But we also have to introduce this to the younger generation, and they have to be more aware of these things. Nowadays, like companies like Pera, we are providing these type of services where you can check your sperm, you know, and you can see if there's something you need to improve on, you know, do you need to cut down alcohol or smoking, you know, or is there a problem that you can rectify sooner rather than waiting 10 years' time and seeing that it's going to be a real struggle to conceive. So for me, it's more pushing towards the future and younger generations.
That is a very nice also take-home message, I think, the raising the awareness in the next years. And I would like to ask Anna, do you also have, like, because we have 2 minutes left, do you have a short one-sentence take-home message that you would like to give after this, to close this panel discussion?
I think maybe just to close up, like the vision of the future of the fertility clinic, I think basically what is going to happen is that patients will go less and less to hospitals and centers, and they will control more the whole, I mean, it is related to this creation, understanding of their own fertility. And I think this is basically something very nice that could complement, right? Like how do we control and make more home tests and diagnostic and a lot of genetic testing, not having to go to hospitals or not having to go to a fertility clinic, and taking more control and maybe go for the egg retrieval, the embryo transfer. So this is a vision that I think I could share to complement that.
I love the addition, because we start off with awareness and then also with patient-centric care, right? Deborah, what would your final message be for the closure of this panel discussion?
Yeah, I mean, all of us here, we are tied to health technology innovation in one way or another. And healthcare is very complex. So my message would simply be, let's not try and solve healthcare problems with healthcare alone. Every aspect in our lives affects our health. Whether you're sitting down, whether you're taking the public transport, whether you're eating, it affects your health in one way or another. Could be positively or negatively. So then why, when it comes to solving healthcare problems, why are we only focused on healthcare systems themselves? Like if we, normally the term multi-sectoral collaborations is used to mean that, oh yeah, insurance companies and public transport and food companies could work together to make healthcare better. I prefer to use the term solidarity, because the multi-sectoral removes the community, the person in between. So let's do all this with solidarity. We should all work together to actually solve healthcare problems. Otherwise, healthcare will remain complex today and tomorrow. We will keep talking about the future and working on new and new innovations, but instead of us solving, we'll be building more problems. We need to work on healthcare holistically. That's all.
Very nice, a holistic view, and we have to do this together. So that's actually a little bit the summary of this panel. Well, I would like to thank our panelists very much, because I love the discussion. I have way more questions, and I'm sure that the rest of you also have some questions. So please approach them or reach out to them on LinkedIn. We're open for any questions or any discussions forward after this panel. And thank you so much for your attention, and thank you, panelists.